In this podcast, we aim to uncover secrets, stories, and methods of those in the forefront of movement practices far and wide. From physical therapy, strength training, mobility training, CrossFit, martial arts, and much more. We want to use this platform to explore topics we love to talk about with other professionals in varying fields to do with movement. A little bit about us: we run Flow Motion Fitness as a personalized online mobility and rehabilitation coaching service. We offer an online course for coaches, as well as retreats and workshops in person. This podcast started when we began doing Instagram Lives, so the first few episodes are taken from our first lives that led us down the route of exploration in all topics related to the health and fitness of the human body that influences controlled and pain-free movement. In today's episode, Chelsea and I are covering all the questions we've been sent in about spine and knee mobility. Hi guys, so we're doing the live on spine and knee mobility, and Chelsea should be joining us in just a second. We've got so many questions from you guys to answer, so I can't wait to do that. Some of the more personal ones that you guys sent in, I'm going to answer after this in stories, but all the spine and knee and movement related ones we're going to cover now. So I think she should be just joining in just a sec. Hello everyone. And yeah, if you have any other questions, please, please just add them in here. Let's see. Should be working now. Just 1 second. Hello.
Hi. How are you?
How are you?
I'm good. Yeah, just getting the morning started here. How about you?
Yeah, good. Afternoon's going well.
Nice. Yeah. I'm excited. We have a lot of questions this time.
So many questions, and I wasn't very clever and I didn't save them, so 1 second.
No worries.
I'm just going to screenshot them again. But yeah, if you guys have any other questions, please put them down.
Please do.
We'll also add those in as well. Do you have any specific questions you'd like to start with?
Sure. Yeah, we'll start with, I had one about why spine mobility would be limited in one direction, but not another direction. So we dive on with this one. I'll get started and then we'll kind of pop it back and forth. So I think there can be a lot of reasons, right? And we assume, usually our first and kind of foremost assumption is, oh, well, they're not able to move in that other direction because it's limited, or because they don't use it enough day to day, or because there's some sort of limitation. And the sort of the preface I always like to give with that is we first need to know why they're not moving in that direction. Sometimes people are told things that movement is dangerous, or they're told things that they'll never move that way, or there can be beliefs that are behind this that are part of the reason or the reason that someone might not be moving in a particular direction. Once we find out that is the case or isn't the case, then I move it into more of doing a movement evaluation and seeing what directions are limited and why. And that could be because of someone's hand dominance. It's quite common. Most people in the northern hemisphere tend to have more right thoracic rotation than left thoracic rotation. There's a couple theories, one being that being right-handed is more common. Another one being if you go to the southern part of the hemisphere, that actually reverses, because just like the toilet water reverses when we go into different parts of the hemisphere, the theory is that the gravitational forces that our body is subjected to changes which directional preference we tend to have through our thoracic spine. Interesting, right? Yeah.
Theories of my own that I've noticed over the years. I don't know if you have, but you can always tell. I don't know, because I think in America you have mainly automatic cars, but in Europe there's both. And well, you can tell if someone is driving an automatic or a manual based off the way their hips work, and that then affects their QL and spine.
Yeah, totally.
So that's really interesting. That one comes up a lot. And there's also been a few people I've met who have been going through bouts of PhDs and studies, and they've been rotating to one side at a desk for years, totally. And they've developed muscular scoliosis. And that's an interesting fact. Just something that you do during the day over and over can contribute massively to that.
Yeah, absolutely. That's a good point. And that's when a lot of us will sit with our screen turned to one side just because it feels more comfortable. But then it's realizing, oh, maybe this is actually causing a little bit of an imbalance. I actually had, I had one towards the right that was, this was before I was a PT or a physio, where I was doing a lot of ultrasound. I worked in a chiropractic clinic and I was always turning right all day, every day, and started to develop some rib pain and some paresthesia that was going out to the outer ribs. And it was before I was a PT, it was quite difficult to get a proper diagnosis because not all movement professionals dive into spine a lot. So if someone's having a spine problem and they're not getting results, just make sure that you find someone that does a really thorough spine evaluation. I think the most important thing is anytime someone finds an asymmetry, that's an amazing thing for you to work on yourself, because anytime we can find that asymmetry and you have the knowledge of start working into it, that's a really easy, free thing that you can do for your body to help with your joint health.
Yeah, exactly. And there's almost always a very obvious movement reason for it. So I've never really seen anyone that has something that come from a reason. You can usually find the cause of it. Like another example is I train a photographer, has to set things up low down on a scene. He does product shots, and because he's repeating and repeating that all day, I suspected maybe that's got something to do with that one side of the QL being tight. So we time-lapsed it, and time-lapsing the workspace I find is a really handy tool to figure out what you're overdoing. Because suddenly we saw he was doing one side, over and over again, and I was like, well, that's why we have the tight QL on one side. So I like that method of checking things out, just because we don't realize how many hours during work that we could be repeating a specific movement and then causing one specific side of the body to behave a certain way.
Absolutely. Yeah, that's a really good point too, because I think what I find with people that have jobs that is really hand intensive, so say maybe photography or hairstylists or even typing, a lot of people get told, oh, well, doing that repetitive activity is bad for you and it's causing damage and these sorts of things. But on the other side of that coin, the explanation that I give, and it sounds like the one that you give too, is
Oh, don't know if the connection's just gone there or.
Oh, sorry.
You back?
Am I back?
Yeah.
Yeah. A lot of people don't get told, hey, there are ways that you can learn to balance this out so that you continue to feel good with the job that you have, no matter how repetitive it is.
Yeah, exactly. Yeah. What was I going to say? Oh, yeah, there was a little question up here saying, can I still get, what is it? Is it possible to get very flexible at the age of 17? It is possible to get very flexible at any age whatsoever. So yes. Answer
yes.
Okay. I'm gonna
yeah, go for it.
I saved a bunch. So someone asked, how often do I stretch? I think that's quite a personal one, but either way, I don't stretch at all. Not really. Stretching is like, this is the confusing part. A lot of people are saying, oh, I want to get more bendy, so I'm going to do yoga, I'm going to stretch more, but I don't stretch. I don't advise my clients to stretch. Sometimes we do little stretches before we do a movement, but really the methods I use are end range strength, functional range conditioning, types of mobility training, but not necessarily just sitting in stretches, because passive stretches are just going to make you good at passive stretches. It's not going to make you good at moving in those ranges and controlling those ranges. It's also, if you overdo it, you can end up having length that you have zero control over. And this is where I suppose this type of stuff that me and Chelsea talk about is kind of like a new subject. People are not quite sure what this is. So like, obviously you want to be flexible, but you want to have strength in that flexibility. And it's not like we're going to be showing you a bunch of exercises that are just stretches that are going to stretch out a pain. We want to be strong in that range that you use, so that if you have strength, then your body has no reason to send you. Right.
Yeah. And I think something I get asked a lot, and I'm sure you do too, is, okay, well, what are the top 10 stretches that I need to do for this thing? And it's like, well, there are 1 to 2 exercises that if they're really well suited to you and they're properly progressed or properly regressed and properly dosed, those movements can do what you need them to do. Not to say that everyone needs 1 to 2 exercises and that's the only thing you need, but for people that are asking about, oh, my hamstrings are tight, or oh, my calves are tight, I think we've been taught traditionally that, oh, well, you need to spend 30 to 60 minutes a day stretching. And really, it can just seam in with the training that you're already doing. It's just approaching that training in maybe a new way or a little bit of a different way.
Yeah. Exactly. Kind of related to that, I had a question asking, how do I stay flexible in the colder months? So basically, you want your body temperature to raise by a few degrees when you're training, so when you're warming up, sorry. So that's usually to the observation of a mild sweat. You can do anything you want to do that. You can do mobility drills, you can do flows, you can do a little bit of a cycle or a row, whatever it is you want to do, but you do actually want to make sure you spend that time getting warmed up. I mean, if you're doing a 1 rep max and you work strength, maybe dial down the flexibility work and just do some light cardio. But if you are just doing a functional bodybuilding session or a strength training session, nothing too intense, you're actually just working on skills, then definitely 10 to 15 minutes is usually about the time that it takes you to warm up when it's super cold. So that would be my bit of advice there. Let your body warm up to the point where you're slightly sweating, just a little bit, and then you know it's safe to start trying more things. Okay.
Great.
Anything to add?
That sounds great. Yeah.
Okay. Where else do we have? Someone asked, is back flexibility and thoracic mobility the same, and when do we need each?
That's a good question.
Good question. So definitely back flexibility and thoracic mobility are different. There's lots of different flexibilities and movements that you should be using in your spine. So for example, your spine should be able to rotate. Thoracic, that's where you're going to get the most rotation. You get much less in the lumbar, but you also have extension, flexion, and lateral flexion. So there's a lot of different things you need to think about when it comes to the spine. And what was the other bit? When do you need? Oh, that's quite a big question.
When do you need, what was it?
When do you need each? So back flexibility, thoracic mobility. So, it's a big question really, because like I just listed a lot of different areas of the spine, and you've got different sections of the spine. So you've got the neck, the thoracic, the lumbar, and the sacrum. But the point is they move in different amounts. And you're not necessarily meant to move them in everything, if that makes sense. So a lot of thoracic drills, you will try to isolate just the thoracic by locking in the hips and the lumbar. So for example, if you're doing like a thoracic rotation in a half kneeling position, you can put a yoga block between your knee and a wall as you rotate to make sure that you're not also rotating with the hip and the lumbar. The same with thoracic arch rotations. When you're lying down, you can place your knee on a foam roller as you rotate to make sure that you're not moving your hip as you rotate. But there's a big misconception here that it's dangerous. It's not dangerous. It's just meaning you're not going to get the most out of that exercise. So a lot of people think that as you rotate, you really shouldn't move your lumbar at all. But that's overreacting to movement, basically. Like we move all the time, to turn around and grab something, to put our seatbelt on. Playing with your kids and your dog, you'll realize you move around a lot and you shouldn't be afraid of any movement. So that's another just a little tip there. Don't be afraid of moving, and don't be afraid of exploring movement. But when you need each is very, very different. So like, should we think of a few examples of movement?
Yeah, that's good. I can take a few.
Yeah.
The thing I would say is, I'm going to assume that someone may have been asking this question, you know how it is with assuming, due to some pain. And I think sometimes the assumption is, oh, I have pain, that means I need to be more flexible. That means I need to stretch more. Sometimes that's the case. Sometimes that's not the case, right? So as we've both seen, sometimes stretching and mobility can not be the thing someone's needing. They actually may need a little bit more stabilization work. And thoracic mobility is a great place to start though, because of just what you touched on. Different part of our spine has a different amount it's intended to move, and that's just because of the architecture of the bones and how they're set up. So thoracic's a really good place to start if someone's sort of just wanting to explore spine mobility and start to try to improve the overall health of their spine. The better it moves, the better their neck and their low back will feel. I can take you through, there's a really quick way that I like to teach my clients to screen it, and then a really easy way that you can work into it in sitting, and then maybe see one of your favorites too.
Okay.
Yeah. Yep. Okay, cool. And I actually use a yoga block like you touched on. Grab that really quickly. And the idea with the yoga block is that it just keeps the pelvis from moving, so that we know that the movement is isolated from the thoracic spine, as opposed to the thoracic spine and the pelvis moving together. So if you take a yoga block, put it in between your knees, you don't have to squeeze it like crazy, it's just holding it there so this stays still. And just look at how far you can rotate this direction. In general, what we're looking for is about 45 degrees, so not here, not 90, kind of halfway in between. And go slowly, because it's really easy to use momentum to sort of create some things that aren't thoracic movement. And then do the same thing, go the other way. You'll see mine going left today is a little bit more limited. So this is the direction I would focus on. And then you can actually use the architecture of the spine to your advantage to create a little bit more movement. So to our spine, rotating and side bending or laterally flexing, kind of the same things happening neurologically. So if we tap into one, we can tap into another. So if you are to rotate and then side bend, which feels amazing actually, and then stay rotated but restack, you'll find that you just created more rotation in the spine purely by doing the side bend. And you can use that to your advantage to quite quickly open up some rotation that was a little bit blocked.
That's really cool. I love that.
Thanks, I love that. This is yours.
The only thing that that's made me think of is something that I use as a screen as well, but it's the only reason that is different is because you're sitting cross-legged and then you can see if the hips are moving, so it's kind of like a test in a way. I can just show you quickly. One sec. I'll just put you on the ground. So if you are sitting down cross-legged, right, and you rotate. If my knees don't move, then that's great. Like, you know, I'm not compensating with the hips. But quite often you'll see something like this happening.
Oh, cool. I like that one.
When you see that, then you know that there's a compensation going on, and then you can look into that and look at that. So it's very similar to what you're doing, but, you know, kind of different way there. And then another screening tool that I use is a very simple quadruped spinal segmentation. And in that way you can see how much the spine is moving. So usually I get people to do like 10 cat-cows first, just to get your neurological connection going, and then you'll try the spinal wave. So really quickly, so I won't do 10, but like, so a few of these, just getting yourself used to moving, and then we're just going to try to slowly segment bit by bit. I'm going to kind of cheat and go quickly, but you get my gist, sort of thing. Like, you just check how much the spine can work independently through each section, and yeah, basically that then means it's like a extra little bit of information that you can use, and then yeah, move forward with fixing the little bits that don't work.
Yeah, so I love that one, and I think that's most of us tend to think of our spine as being like these larger muscles, right? Kind of like the big ones that we can see, but we have all these tiny muscles that connect one vertebrae to another, two vertebrae to another, and there's so many, and they're so intricate, and it's a really great way to tap into all those.
Yeah, and there's a lot of people afraid of moving the spine, or they think because they've had an injury or a herniated disc that they shouldn't move. And I've heard this a lot, where a doctor or someone has said, oh, you'll never move your spine normally again, and nor should you try to. And that then causes tension. Like you said, you've had a few people tell you that, and they actually have a lot of tension in their spine to that. And I was myself, I will never move my spine again normally, and I was terrified of moving it for a long time. I didn't even hip hinging, because hip hinging to me was scary. So, you know, it's really interesting how that tension can actually increase the pain that you're going through.
Absolutely, yeah.
Actually, going back to that cold question, when it's cold, you're going to tense up more. And then your pains might bother you a bit more, so. Hi, Cal.
Thanks.
She's a little head peering in.
I could
see him on like my shoulder, his head was
hearing it over. Yeah, so I suppose, yeah, now that it's starting to get colder, the season's changing, we're worrying about warming up. So yeah, definitely warm up first. You should feel better immediately after that anyway. But yeah, try to stay warm, avoid your muscles tensing up. Looking through the
Yeah, I can pop one of my questions.
Yeah, go ahead.
Yeah. I had one about helping with arthritis for someone that was younger, was about 20 years old.
Okay.
So this opens up a lot of different topics, as you know. So I'd say first and foremost is we start having changes in our body around our teenage years that show up on x-rays. And those often become diagnosed as arthritis, degeneration, things like that. They can be quite scary to hear. I was diagnosed with this when I was 15. I was terrified. I started walking differently. We talked about this last time. I stopped training. I thought my career was over. And a lot of times that was no one's fault other than I just heard that information. And from that information, I gathered all these things. No one even told me that it was a lifelong thing, that it was going to get worse. But we just hear arthritis. We think arthritis means X. And then from that, we take on all these beliefs. So I think the first thing that I would say is that the best thing that you can do for your joint health is to continue to move your joints and continue to load your joints. We think of loading and stress as being bad. Stress can be productive, particularly for our body, in the right dosages, in the right amounts. And stressing the body through resistance training will help to improve the health of your cartilage. So a lot of people get told, oh, well, we're seeing these changes and you need to stop doing this, but research shows that makes no sense. And it's not that
I think yesterday about it.
Totally, yeah. And not that, sometimes people may need to scale back exercises, absolutely. And sometimes there's an appropriate time to scale back, but stopping it full out is not the best advice. So if someone's been told that they have arthritis and are having pain, that's when we want to get a really thorough movement assessment to figure out why you're having that pain, so that the pain can be addressed, so that you can get back to doing those things, loading your joints, staying active, exercising, and getting your joints as healthy as possible. And I just had a question come in on this too. So resting is not a good idea for arthritis. No.
For life.
Yes. Yeah. Resting may be an appropriate, I find it to be needed very, very little, much less than we're told. But a long-term plan of avoiding movement, avoiding loading for arthritis is not a good plan. That can actually prevent you from making progress and improving the health of your joints. And I think we tend to be less happy individuals when we're not able to do the things that are really meaningful to us movement-wise. And that is just as important as all the physical stuff that we're talking about too.
Yeah. One of the most interesting things to remember is like where movement goes, your blood's going to flow there. You're going to get more blood circulation, you get nutrients, that tissue, you're going to start healing. And as long as your nutrition is good. So one thing I have realized, if your nutrition happens to be particularly poor as you're growing up, there could be a bit of a connection with more issues going on with pain and stuff. Obviously, it makes sense. You're not actually and at the time where I had nerve damage, discs at way too young of an age, and extreme pain, that was terrible. And I don't think it was a coincidence at all. There is a lot of connection with how you're looking after yourself. You can play around with hot and cold therapies. You can play around with so many different therapies that will actually add on to the exercises as well that you're doing. So it's quite a big topic, but generally speaking, movement is the foundation. Without movement, you're just gonna go backwards with that, and especially diagnosed at a young age, that's not a good idea to stop moving.
Yeah, it's kind of like the old, it's funny as you get older, like the old sayings that your grandparents used to say, like, wow, that was really wise, Like I remember use it or lose it.
Yeah.
It's so true.
True. Yeah.
It's so true.
And, your joints. So with your joints, like most people don't actually express full range of motion of their joints. Not every day, sometimes not for years, which is why cars are so good. So when I say cars, I don't mean cars, I mean controlled articular rotations. Cars are actually the opposite. But yeah, when you do joint circles, when you do them mindfully, then you're actually pressing full range of motion of each joint. And if you can do that, obviously it's not going to make anything better, but it is going to maintain what you have. And if you also work it in a linear fashion, then you can get better at your joint circles and get better at that. So another thing about all joints in the whole body is make sure you move them at least in some every day. And if you're not moving them, then that will be a very good sign as to why they're not getting better, why there's degradation, or why you're getting pain. So it's another little tip.
Yeah, totally. You brought up a good point that I want to elaborate on too. Is like if someone's experiencing knee pain and they're told it's due to knee changes and knee arthritis, what you can do, one of the easiest things that you can do for yourself is focus on mobility elsewhere. If that area is painful, if you're not able to move it for any reason, focusing on mobility in nearby joints is still going to give you benefit, it's still going to improve pain, and it's still going to improve your function. So you can work on ankle mobility and strength, hip mobility and strength, and just build up the areas around it. And a lot of times that will help to decrease the pain so that you can get back to loading the knee itself of doing squats or lunges or whatever it is that might be the thing that is feeling held back at the time.
Yeah. That brings me to another point is your knee unstable or is it stiff? And there's very big differences there. And then looking into that, you develop a better program, especially with a coach, to then work on bringing back stability and strength to the knee so that you pain. But yeah, it's quite common that people's knees are quite stable, and that can be coming from the hips. And well, that's why so much to work on the areas connected.
Totally. Yeah.
Yeah. Some really random questions here, which I'm just not going to answer right now because they're not relevant. How do you target stubborn areas of spine segmentation? I have a little tip. There's so many ways. First of all, I need to say, like, this is just one way. This is just a way to feel better. So I'm gonna again put you guys on the floor. So you can grab like a band. And you can actually do this sitting if you want. Like you can sit down, put the band around your back, pull the band forward, and this can be a belt. It's just for proprioception, just so you can feel. And you're going to tuck. So you're basically just doing cat-cows with the band, and then you're going to work your way up so you can feel. And what you're going to try to do is concentrate on pushing into that specific part of the band. And when you're going forward, you're also going to brace a little bit, so not just like tugging and not thinking about it, you're actually using muscles to control all of it. So you can do this quadruped, you can do it seated, but you get the gist. It goes up the spine, and then you get to build a bit more strength, a bit more control in areas.
Yeah, cool. Yeah, so they were asking about segmentation, specifically like specific segments and getting those to isolate.
Sorry?
I guess the question was about segmentation, like specific segments and getting those moving.
Hold on, let me read it again. It just said, how do you target stubborn areas of spine segmentation?
Okay.
But if you collaborate with different things, go ahead. Like, still.
Oh, cool. Yeah, I was just curious if it was. I want to make sure I understood the question right.
No.
Yeah, I love that one for lumbar flexion. Something for thoracic extension that can be helpful is when I'm a big fan of when we're learning to move an area, just kind of using the other muscles that also do that same movement as some support. And then as it's kind of like having the training wheels on the bike. And then as we need those training wheels less and less, we can sort of ditch them. So with thoracic stuff, this is actually something I learned from the Pilates world. If someone is working on, can you see me okay? Oh. Let's see.
Almost.
Playing for angles is always fun, right? Okay. There we go. Okay. So if someone is working on trying to extend through the thoracic, which we mean here-ish area, And we're able to move the low back a lot, but we're not getting a ton of movement like from the actual thoracic spine. Something you can think of is my hands aren't actually going to move, so you're not going to see it, but I'm thinking about pulling my hands down towards my hips, which is going to help engage my lat some, which automatically is going to induce a little bit more thoracic rotation or thoracic extension. So you can use that connection by pulling to get yourself a little bit more extension if that's an area that is a little bit tough to move, which for most of us, it's a tougher one.
Yeah, because we spend so much time with arms forward.
Yeah, exactly.
So much of just staying like this.
Yeah.
Eventually get bad. That was a really good tip. I like that one. I'm going to use it.
Cool. I like yours too.
What else? What exercises or stretches can help with tight knees?
Ooh, tight knees.
So you do want to look into your ankles and hips, but there's also you can do knee calf if you want to start exploring different ways of moving your knee rotation. I can go through that quickly for you.
Yeah, go for it. Yeah, go through one. I'll go through something too.
To the ground. All right, hopefully you guys can see me. So you're going to want to avoid moving too much of the bone here. So you're going to grab your leg underneath like this, and then you're going to put your hand on top so you can feel the rotation. Yeah? So what we're going to do is we're going to come up. Oh, hold on. You're going to come up while you're rotating the foot out the way, and I don't mean just go as far as you can with the ankle, just rotate as much as you can with the bone here. And then from here, you're going to come up. When you start feeling a bit of a stretch, you're going to come the other direction, so in the way, and then you're going to come down. And you're basically just doing these little circles. And then you can go the other way around, if that makes sense. But yeah, that's not really my favorite exercise, but it is one way to try to start to feel a little bit more of movement through your knees. And obviously I showed you guys last time, the knee, the sort of like, you imagine you're standing on a clock and your knees are going in different directions. I think I showed you. I'll put you here so you can see. And it's really quite, damn it, a lot of it. I don't know where to put you guys. Okay. So imagine you're standing on a clock and then you're just letting your knee, if you look at my knee sideways, it's like moving in different directions, and you're kind of going around this clock trying to touch each number on the clock with your toe, and then you can do it with your hand as well, and then you're basically just, a lot of this is ankle and hip, as you've noticed, but it's also allowing your knee to explore different ranges.
Yeah, totally.
There's another question. I have a lot of popping sounds in my ankles.
Yeah, I'll start.
So do I.
Yeah, so do I. It's funny, they've done, as you know, they've done a lot of research on this. They're like, what is this sound? You know, because it's a little bit of a mystery. And the current theory is that it is gas escaping our joints. It doesn't have to mean anything bad. I started getting, like, a lot of people call it the Rice Krispies. I started getting those when I was like 15 or 16, and same thing. I was like, does this mean my joints are going to degrade and I'm going to be, you know, like I'm going to have a knee replacement? You know, we all think these things, right? And there's nothing inherently bad or harmful about the popping or the snap, crackle, pops. If it's painful, then we want to look into what do we want to do to help with pain. But the noises itself, no need for concern.
Yeah. Like my knees are super loud. Like you can hear my knees more than you can hear my feet when I'm going upstairs. So not nice. It is. And doing pistol squats basically means I need to put headphones on because it's just too gross. Don't panic. It doesn't mean that your knees are about to fall apart. But it could mean maybe look into strengthening your hips, ankles, and knees to the point where you're not worried. Because that, you know, if that sound sets off ears, then you maybe work on it a little bit so that you're not freaking out.
Yeah, totally. Yeah. And some people do. I've had some clients where they work on hip strengthening and lateral chain strengthening, and the popping sounds change. Yeah. Sometimes that happens, but it's never. For me, it's not the most important part of their care, because I know they can be pain-free and still have those things. So
Yeah.
cool. Yeah, you made me think of one thing with stiff knees. A lot of times when I hear clients say they have stiff knees, it traces back to more of a hamstring based thing, and it's hard for them to extend their knee, and by that I mean like straighten it out all the way. These camera angles are a trip. So
Bring the leg out.
Yes, yeah. Do this every day. I think one of the easiest things that people can do to help with their hamstring length is deadlift. And a lot of deadlifting gets this really bad rap of like, oh, is it bad for your back? It's not bad for your back. Sometimes people have back pain with it, which means we want to look at how you're deadlifting, and that will take care of it. But I think it's one of the easiest ways to improve hamstring length. You can mix it in with your workouts that you're already doing, and that will help loosen up the knees quite quickly.
Yeah, and like there's so much you can really play around with RDLs and Jefferson curls are one of my favorites. I really love them, and there's different variations as well. So they can cause like quite a lot of new tension at the beginning. So you can actually adapt them, get used to the movement. So a lot of people are like, right, do it strict. Just do the Jefferson curl with completely locked out legs and squeeze your legs together, and that's it. It's like,
Yeah, right.
It can be painful, and it can, set off your sciatic nerve. So you can also just actually do it with your legs slightly wider and bent, because you don't have to create that much strength. Like you can have a bend, and that's fine as well. So
Totally. Yeah. You do regular ones.
Tangents easily here.
Oh yeah. I think it's so touches on a concept that you and I are really familiar with, but a lot of it's newer information. It's like your workouts can leave you feeling great and improve your mobility and get you more flexible. And it's those simple little tricks like that that can make such a big difference, because instead of spending 30 minutes a day stretching your hamstrings, just do a few rounds of deadlifts, and that may be all you need.
Yeah. I mean, I'm glad things are really changing, but it's still a very new world of going, right, I'm going to go into a workout to try to improve my movement and actually improve my joint health, rather than my workout and try to get as many calories burnt and lift as many heavy things as possible. So that's exactly how I used to think.
Oh, same. Yeah.
I just work as hard as possible until I collapsed. And I wanted to get as much muscle burn, as many calories burnt. I didn't care about, was this good for my body? And it wasn't. So when you start, okay, I can actually work out with my joints in mind, then it completely changes your whole workout. You start doing really unusual things in your workout. For example, like deficit split squats or Jefferson curls, or you're going to be working on planches and like skill work, which still build a huge amount of muscle. They still burn a bunch of calories, but at the same time now working on improving yourself so that when you're 70 years old, you still can do these things. Do you guys take coffee? I used to. Sometimes I forget.
Yeah, I currently don't. I have in the past.
Yeah.
These days I'm making sure I take my probiotics and my other supplements, and I'm feeling really good about that. So
What I currently take is magnesium and vitamin D. Vitamin D is both of those work together nicely, so it's more, your vitamin D gets absorbed more when you have magnesium, and likewise the other way around. So magnesium I take because it improves my sleep quality, and I am known for being a bad sleeper. Vitamin D, and stuff, we don't get enough of it. Highly connected to immune system stuff, but apart from that, I don't take anything. So yeah.
cool. I take what do I take? Probiotics, magnesium, vitamin D. Sometimes I'll throw some selenium and zinc in there. And I in no way specialize in nutrition, so I will preface. And my favorite nutritionist to follow, his name is Chris Kresser. He's fabulous and posts a lot of research with his articles, so he's a good resource. You would know him too.
So if you guys want to go really in depth with how your blood work can change from different exposures like toxins and mold, then there's by the way, most of us are exposed to mold, and it can affect your blood work, and it affected mine in the past. Conscious Nutrition UK, I don't know if there's like any kind of scores there, but he's got a fantastic account. He goes really in depth with studies and talks about how mold in your home and other side effects, like starting to feel dizzy, or perhaps the thing that happened with me is my heart rate went really, really high for a very long time. For about 2 weeks, it was above 100. Between 100 and 190, and I couldn't like breathe properly, and that was really peculiar, and that's because I was exposed to mold, and little did I know that affects your red blood cells, and then I couldn't get enough oxygen around my system. And as someone who had very good nutrition and worked on my diet very well, I have a nutrition certificate. I was very confused. I was like, I am not doing anything to cause this mold exposure. So just one's getting any kind of side effects, there's people out there on Instagram you can get information from and get to the bottom of that random stuff.
Awesome.
Yeah. Do we have any other questions? Because I don't know if I've gone through all of them. Do you have any stretches to help? I'm assuming that says hip impingement. And like you said earlier, better to really check out if you do have a hip impingement, because it's not all that common.
Right.
Yeah. There are things like banded distractions that you can add in, but generally speaking, I'd say with anything like this is, if you want hip stretches, I'd go for do hip mobility full stop and work on your rotational hip mobility first before you worry about it. What do you think?
Yeah, I find, so there's, as you know, there's a couple different types of hip impingement that can show up on x-rays. People can have those and be completely asymptomatic. And this was particularly with the hips, like 80% of college athletes have labral rotators. There's a lot of things that we have that will show up on x-rays and MRIs. It doesn't necessarily mean we have to have pain. So if it's been diagnosed with an x-ray and MRI, or sort of that bit of information, what I'll also see a lot is when flexion or internal rotation is uncomfortable or painful, that someone gets diagnosed with a hip impingement, even though there hasn't been any sort of x-ray or MRI done. Either way, what I find to be most effective is focusing on the hip mobility that is limited but non-painful first. So typically that will be extension, external rotation, abduction. So improving hip mobility, but improving the directions of hip mobility that feel good. And then a lot of times that will unlock where we can sort of visit flexion and internal rotation later. So my general advice would be focus on hip mobility in ways that aren't painful, and then have someone to guide you through how to best work through the hip mobilities that are painful.
Definitely. And that's like a really good bit of advice for all the joints. So if you pain any of the joints, just work with the ranges that you do have that are not painful, and eventually you can start adding in different things. But to begin, don't force anything that hurts.
Yeah.
Seems obvious, but it's not.
Yeah, and I think there's a little bit of a trend I've noticed on Instagram with working into flexion and internal rotation because it's limited. It is often limited, but doing sort of like end-range flexion, end-range internal rotation, so it can be easy to think like, oh, I need to work on that thing because that's the thing that's limited and painful. So knowing that there's so many different types of directions that our joints move in, and like you said, finding the one that's non-painful and then kind of going from there. I feel like flexion and internal rotation is kind of popular right now.
Could be.
I've noticed it more. I don't know. Wow.
There's a lot of rotation, that's for sure. Yeah, I'm seeing a lot more rotation, and yeah, definitely coming up, I suppose. Right, just checking if there's any other questions. Covered all those. Okay. How would you start with knee mobility exercises? Are there progressions?
Knee mobility exercises. Well, great question. I would start. I'll get my spiel and then
go ahead. Yeah.
Pop it over to you. Okay, cool. First thing I would say, what I hear a lot, and this is a very normal assumption is if this area hurts, that means I need to work on mobility in this area that hurts. So my knee hurts, that means I need to improve knee mobility. Unfortunately, it's not that straightforward. And more often than not, to improve pain, we need to work on the area next to it. So with knees, we want to work on improving hip mobility and ankle mobility. And it can seem like, well, my knee hurts. Like, why are we doing knee exercises? And there's tons of research behind this. Hallie and I have spent years and thousands of dollars studying these things. So just take our word for it and run with it. So you want to focus on hip and ankle mobility. If sometimes working on hip mobility and ankle mobility isn't everything someone's needing. There are particular directions that the knee moves, like rotating, that sometimes can get a bit stuck, and working on the hip and the ankle itself won't kind of like rewrite the system, and then we need to address knee mobility. But I typically say that for the last, because I find that oftentimes our body will sort of right itself given the right tools. So if we kind of go through the funnel and we're like, okay, we need to address knee mobility. That exercise that you did, actually, that knee car, is one of my favorite things. And something that I will share that I find helpful with my clients, and I think I saw this, I probably saw this on Instagram, to be honest, is taking and putting like a marker and put a dot right on this bony area, because it's really easy to actually be moving from the foot and feel like, oh, I'm doing it. But until we get the actual tibia itself rotating, we're not working on knee mobility. So just take like a little pen or something and then look at it and see if you can get the bone to move back and forth.
Yeah, I've seen you talk about this, yeah.
Cool. That's my spiel.
Yeah. So I agree with all of that. And again, like, I think, to be honest, start with ankles and hips. Again, we're saying this again and again and again. But there's almost no point of going straight to the knee if you're not going to address the ankles and hips anyway. So you have to make sure there's no restrictions in your ankles or hips if you start worrying about something like a knee. When it comes to progressions, there is a bunch. I mean, the easy thing, I suppose, would be like standing on that imaginary clock and just going around in different directions and seeing if your knee is capable of just slightly moving into different directions. That's a whole kind of body approach, because then you're going to feel if your ankle and hip will let you do that. So if you do it with your hands, and then I should make a whole video on this actually for YouTube, that might help. But yeah, you want to test all of that stuff first. Another thing I really like, which is kind of almost not related, but if you are getting knee pain when you move, quite often you can kind of get the right muscle in your hip start kicking in and stabilizing you if you just get a band and pull it in the way, so that you have to slightly push the knee out the way as you're lunging. So, for example, do this really quickly. And I have nothing to attach this band to, but I'm going to ask you guys to imagine it. So, like, put the band, like, just on your knee, and you pull it in, and then as you're lunging back, this is going to happen. And that's something that happens quite a lot, but then with the band, you're going to be pushing out against it. And then something as simple as that, like, I find that extremely common anyway. A common thing to help with a little bit of instability and pain. Because I think a lot of us have quite tight adductors. Yeah. And we definitely have this ability for when we squat, when we deadlift, when we lunge, our knees kick. And that's, if that's happening, there's no point worrying too much about perfect knee mobility and perfect everything, because the movement pattern itself is, for some reason, you're going into a strange movement pattern, and you're not going to have strength there. For example, like in a squat, if you can't push your knees out, can't use your adductors, you're losing a bunch of strength, because a squat is actually quite a lot more an adductor exercise than you think. So if you're not able to tap into that, then it's all sorts of things are going to be happening, and you can't really say, that your knee needs mobility when your hips, for example, and your rotation in your hips is not there for you, if that makes sense.
Yeah, totally. It's like hips and ankles are the foundation. And
yeah.
Everything else feeds off that.
For this.
Say that again, sorry.
It's so easy to go off on tangents with this. You just end up going, right, there is 10,000 things I can tell you guys, so I'm just going to pick one, and then you start going down rabbit holes.
Right, yeah, exactly.
But yeah, thank you so much, everyone, for all your really good questions, and we're really happy to
thank you.
If there is any other questions or any exercises that you guys want explained right now, but we were aiming for 30 minutes, and obviously we failed again.
We got it under 50, so that's a new record.
I'm proud.
Me too.
I think we've answered way, and yeah, if you guys have any other questions, please send them our way, and we will try our best to cover it in the next one.
That's great. Thanks for all the good questions. Thanks for having me.
Yeah, of course. And soon.
See you soon. Okay.
Okay, have a good day.
Bye.